Hello everyone, warm welcome to our channel. Today we are going to discuss about the second class of mycosis. As we have already understood the introduction part, we have already understood the dermatophytes. Now we are coming to the subcutaneous mycosis. After that I will take only two classes, one class for systemic mycosis and another class for the opportunistic mycosis. After that, the mycology basic introduction part we can easily complete. Okay, that is the part one of mycosis, that is the basic as well as the general idea of every kinds of fungus. Okay, after completing the mycosis I will start another type of series and you have to write down into your comment box which kind of series you want. Okay, and without doing any kinds of delay, let's start today's video. Okay, we are understanding the subcutaneous mycosis. If you are noticing, that is a word, that is a subcutaneous, means they are not only involving into the skin. Okay, they are also involving the any other part of skin as well. Okay, so that the name of the particular fungus as well as name of the particular infection is the subcutaneous. Okay, after that, what are the thing we are going to understand? See here, you will find out under the skin. Getting my point? Dermis, tropical region, traumatic implant as well as the chronic infection under the skin. Getting my point? Not only the superficial, as well as we have already understood the superficial mycosis into the dermatophytes, right? They all was superficial. They are not superficial, they are the under the skin, so that's subcutaneous. Okay, now see here, we are going to understand about the introduction part. We are going to complete the classification, we are going to understand how to diagnosis, we are going to understand the what are the specimenistic world, after that culture, after that microscopy, after that prevention, and after that there will be a quiz only for you guys. Okay, let's talk about the subcutaneous mycosis introduction. If you are understanding that what are the particular attacking area or affecting area of this fungus, see here, they are affected into the dermis region, they are affected into the subcutaneous tissue, they are affected occasionally bone. Okay, not normally but occasionally, sometimes they are attacking into the bone, sometimes they are also affecting to the bone. Got it? Now see here, they caused by the traumatic implantation of the soil as well as plant dwelling fungi. Got it? Now understanding the epidemiology. Epidemiology means where they are basically into the prominently belonging. See here, if you are noticing, see here, tropical and subtropical region like Africa, Asia, Latin America, this kinds of region, they are basically causes. Okay, entry of root means how they are enters into our skin as well as into our dermis. See here, through the thrones, through the soils, through the skin trauma. Got it? Chronicity means how they are developing. They may develop slowly, they may persist for years if it's untreated. If you are not treating the particular fungus, they will persist into the long year. Okay, see, after the host status, if you are understanding, they basically affected to the immune competent individual, unlike the opportunistic mycosis basically happening to the immune compromised individual, but they are happening into the immune component, immune competent immune competent individual. Getting my point? Immune compromised is different things, immune competent is different things. Okay, let's come to the classification. There is basically 5 type of classification, and into your surroundings as well as into your normal textbook, you will find out this 5 type of subcutaneous mycosis. They all are too much pathogenic. Getting my point? Into our medical mycology aspect, we need to understand these 5. Okay, first one, if you are noticing, that is called sporotrichosis. Okay, causative agent, that is called Sporotrichus sinki. See here, that is the rose thorn or plant trauma. First one. Second one, if you are understanding, that is the chromoblastomycosis, or we are saying that chromoblastomycosis. Getting my point? What are the causative agents? See here, see here, see here. Cladosporidium. Okay. After that, Fonsesia. After that, Philophora. They all are the causative agent. Here is the special features. You will find out the squirrel's bodies. Lots of time these kinds of MCQ will asked. Okay. Rose thorn, where after that squirrel body, where they all are too much important thing you need to remember. Okay. After that, mycetoma, and as well as we are saying that the Madura food. Okay. They basically found it into the South India. Okay. Madura food. That they basically see here mycetomatis. Okay. They are the causative agent. You will find out into the grains or granules in past. Getting my point? After the rhinosporidium seaberry, that is also one type of subcutaneous mycosis. And into the particular rhinosporidiasis, what are the things you will find out? You will find out the blobs on nose. You will find out that is the endemic in India. Into the India, you will find out that within the particular region they become too much higher in amount. So that we are saying that endemic condition. Okay, whenever the infection basically occurred within a certain area, that is called endemic. Got it? After that, after the lobomycosis, the causative agency here, Lacazia lobiu. Okay, you will find out that dolphin contact means the infection basically happening by the dolphin contact, and you will find out the keloid like lesions. Okay, here is the special features of the particular fungus you will find out. Got it? Now, okay, that's all about the classification. Now, how do we diagnose the particular fungus? So for diagnosis the particular thing, firstly we have to collect the specimen, right? Without collecting the specimen, how do we diagnose it? So that firstly we have to collect the specimen. So here, first specimen we may collect, that is a pus or discharge. Second specimen, that is a skin scraping. Third specimen, that is the biopsy. Fourth specimen, that is the aspiration. Fifth specimen, blood, that is very much rare. Okay, and sixth, that is the crust or scabs. Please keep in mind that where the infection occurred, you have to collect the sample from the particular sites. That is the logic of understanding the specimen. Okay, if any kinds of wound related problem, if any kinds of skin related problem, then you have to collect the skin scraping. If any kinds of pus or discharge related infection basically occur, then you have to collect the pus. If the infection is related to your tissue, then you have to collect the biopsy. If any kinds of lymph node related infection basically occur, then you have to aspirate the lymph node. Okay, if any kinds of dry cuts basically founded into the lesions of chromoblastomycosis, then you have to collect the crust or scab. These kinds of whole specimen you may collect. Okay, based upon the infection you have to collect it. After that, see here, that is the culture. So that we have already collected the particular specimen. Now that is the most common culture media that they are into the mycology. The interesting things is there is only certain type of culture media for medical mycology. Into the bacteriology, you will find out lots of culture media. But whenever we are coming to the mycology, the culture media's level are too much rare. Okay, see here the culture media. First one is the SDA, subordinate dextrose agar. You will find out the particular temperature, that is a 25 to 30 degrees centigrade temperature. Okay, after that, brain heart fusion for the east phase, that is a 37 degrees centigrade. Okay, and subordinate dextrose agar with cyclohexamide plus chloramphenicol. Please keep in mind that chloramphenicol for inhibiting the bacteria, cyclohexamide for inhibiting the fungus. Okay, that is the selective. You will find out 25 degrees centigrade. After that, potato dextrose agar, that is not too much widely used into the medical mycology, but here is present sporulation and colony morphology. You will find out. Next one is the nigar seed agar. Okay, for the melanized fungi. Getting my point? Here is an interesting thing. You will find out that some kinds of dimorphic fungi there is present. Dimorphic fungi basically you will find out two states. One state is yeast and another state is mold. Yeast you will find out into 37 degrees centigrade, and mold state you will find out into 25 degrees centigrade. Please keep in mind that one dimorphic fungi, here is a sporothric. Got it? And dimorphic fungi always have two states. One state is 25 degrees centigrade, that is the mold, and another state is 37 degrees centigrade, that is always. Please keep in mind that. Okay, that's all about the culture media. Now we are coming to the staining. Here is a rare staining. You have to do the KOH mount. You may do the lactophenol cotton blue for morphology of the culture mounts. Okay, but you may do the fast, okay, for the biopsy related specimen. Okay, after that you may do the gomori methylene methanamine, after that Hg. Okay, uh, now we are understanding the microscopic finding. I have already told the particular things. Squirrel body you will find out into the chromoblastomycosis. After that asteroid body you will find out into the sporotrichosis. Okay, grains you will find out into the mycetoma. After that sporangia you will find out into the rhinosporidiosis. Cigar like shape, very much important, very much important, very much important. You will find out the particular question in various examination. Sporotric. Okay, please keep in mind that. That's all are the microscopic finding. Okay, whatever we have already discussed. Now we are already come in the prevention state, so that we have already covered a very basic idea regarding the particular fungus, and I have already told you that into the YouTube that is possible only covering the basic things. If you are understanding, as well as if you are taking the deep knowledge, then you have to join into our platform. You will understand it. And naturally, into our particular classes, we are taking the class for one fungus as well as for one bacteria, for one parasite, for one single microorganism, minimum 1.5 hours, so that you are understanding that how deep study we are going to do into our particular batches. Okay, so that if you are interested, then you may join. Okay, and that is a very basic thing. If you are understanding, if you want the deep understanding of the particular topic, then you have to join. Okay, see, and into the YouTube that is possible, only covering the basic things. See here, we have to prevent the water protective water we have to collect. Okay, wear protective footwear means we have to prevent our foot from any kinds of fungus. Okay, uses gloves and clothes properly, own care we have to do. After the early medication attention means whenever any kinds of these kinds of symptoms are occurring, yeah, we have to go to the medication and we have to take the medication. Got it? After that, hygiene we have to maintain, and last one is the health education. Okay, okay, that's the questions for you all guys. Just write down the particular answer into the comment box. Okay, okay, thank you so much for attending the class.